I'm Sohit Kanotra. I'm the director of the Pediatric Airway Program at Children's Hospital, New Orleans. The one laser which I'm using right now is the Lumenis UltraPulse DUO. The UltraPulse is a very high frequency laser. It basically gives a high peak energy and gives an adequate amount of time for the tissue to relax in between those high peak energy. So the amount of collateral damage is reduced significantly. We had a 4-month-old baby, and he had the most common cause of noisy breathing in the child, which we call laryngomalacia or floppy larynx. He was struggling to breathe, so rather than breathing to a wide open airway because of that floppiness, she had significant narrowing of the airway.
He started having a lot of breathing issues. He has a monitor that he wears at night, and it was going off for low oxygen levels.
What we ended up doing in him was basically lasering all that floppy tissue and removing it. And after the surgery, he's just a different baby now.
And the change was immediate. I have a video of him, and his chest is caving in and his throat just from struggling to breathe so much. And the day that we got him home from the hospital after, he had recovered, I took another video and it was just completely different. There's just no words to describe it. Just to not see your baby struggling to breathe is amazing.
Tylon was a boy who was involved in a road traffic accident, and he had to be put on a ventilator for a while because he had developed a blood clot in the brain.
It was really scary because from day one it was kind of like being in where my child go. So right after that I just prayed.
As a result of that breathing tube present, he developed severe scar tissue in the trachea or the windpipe.
When I got out the hospital, they said I sounded like Darth Vader.
When they looked down his throat, they don't know how he was still alive.
We ended up doing multiple endoscopic procedures using the laser in this case. And he has done amazingly well after the surgery. So we have actually avoided doing an open resection on this child, which would have been a very high-risk procedure for him, and we were able to manage him endoscopically through the mouth without any incision with the use of the laser.
Look, Tyler. It feels good to sit down and, watch him just run and play basketball or play football with his friends and not breathe like he was breathing before.
Kiana was a very interesting case. She was a kid who had some trauma at home. She had a breathing tube placed in because she needed to be on the breathing machine.
The state called and said, we have a very fragile baby with very extensive medical needs.
As a result of the breathing tube placement, that had produced a lot of scarring in her voice box, and she could not breathe because of that scarring because the voice box was pretty narrowed. So we had to do a tracheostomy at that time because her narrowing was significant, which we call as grade 4 stenosis, meaning the highest level of narrowing we see in the windpipe. Eventually, we got the trach out within 2 months of the surgery.
Your trach is bye-bye.
Yeah. As a normal process of healing of the grafts, they develop what we call as granulation tissue, and I'd use laser for removing that granulation tissue, keeping the grafts healthy so they can heal in a proper way and give Kiana the airway she needs. How's it going?
Say hi.
And now she's trach free, she's singing, she's playing, she's being like a normal, healthy baby.
Without that surgery, we never even could have heard her voice.
Hi. Tell him. Hi. Good job, Kiana.
So all these kids have different pathologies in which we use the laser in some form or the other. It's just the amount of effect you have on their life. They have a long life to lead. So whatever you do to them as a kid is going to be with them for the rest of their life.